Dr. Carlos Barrios integrates metabolic and functional principles and psychiatry, leads a telepsychiatric practice, and promotes medication independence with diet interventions. Please welcome Dr. Carlos Barrios.
Good morning, everybody. Good morning, everybody. Thanks, Dave. It's for child psychiatry specifically. Good morning, everybody. So I've been doing this for about 20 plus years, specializing in child and adolescent psychiatry, utilizing telepsychiatry, covering California, many other states, and integrating those principles of metabolic and functional methodologies to bring people into medication independence wherever I can. I'm committed to this by knowledge sharing and to make it an aim to add clarity and insight so that all of my colleagues and families taking care of children and adolescents can have the common goal, and so that we can all learn together how to move this thing forward, and this is why we're here today. So for me, everything started in 2000, in the middle of my anesthesiology residency. I was struck with a throat cancer diagnosis, and my ENT said, we can't do surgery because otherwise you'll never be able to swallow again. We have to do radiation therapy. I was determined not to let that shorten my life. So 5 months later, I was battling with muscle fatigue and flu-like symptoms, just, thyroid-related stuff because the radiation was hitting my neck, and I had to go on a medical leave. But then some health issues started, increasing blood pressure, BMI, macular edema in my eye. I was risking retinal detachment, blindness. So somehow I found Dr. Christopher Nabi, renowned ophthalmologist, articles on the connection between seed oils and macular degeneration. 2017, oh, by the way, I was doing a vegan diet at that point, which is very kind of a dirty process, like, if I think about it. But anyway, 2017 did a lot better. Keto diet started. Oops. Yes. So keto diet started, did a couple of other things, Wim Hof breathing and kettlebell training, and all of that brought my BMI, macular edema was gone. And then last Thanksgiving, I was watching some YouTube videos on carnivore diet with Dr. Anthony Chaffee, and so I went all carnivore. Since then, lost 20 pounds, and I'm at a 13% body fat percentage. Thank you. Yeah. And so those are my numbers right there. I really look at the triglyceride HDL ratio more than anything else. I think LDL is kind of like bunk. I'm optimistic about really extrapolating what I learned about myself towards my patients. But we have some challenges ahead. Pediatric obesity is clearly on the rise, 1.5% increase per year for the past 30 years or so. It's tripled in in adolescents, doubled in children over that time. And pediatric hypertension follows closely. So in a room of 30 kids, it would be rare to find hypertension 20 years ago, but now it's 1 has hypertension, 3 will closely follow. And as it turns out, if you're overweight, 75% chance you will be hypertensive. If you're obese, that jumps all the way to 205%. So the American Academy of Pediatrics has thoughtfully decided that how they're going to address hypertension is to lower the BMI with the DASH diet, exercise, so like lifestyle recommendations. But if the above fail, let's go ahead and jump into antihypertensive medication management. Really? Okay. I don't think so. And just what is the DASH diet? Well, after 20 years, it's had a 1% adherence rate. 55 to 60% grams of carbs daily are recommended. So you're telling me that for a kid with BMI that's high, 400 grams of carbs a day? Sounds ridiculous? It is. So there's more on the front of medication. So in order to lower LDL, and I just told you that LDL is kind of a bunk connection with plaque formation, if they meet a certain criteria, they're to start statins and exactly. I'll just skip over that and go to the next thing. But get this. So Ozempic, with 55 lawsuits for gut blockage, comes into the picture. It's approved for kids 12 and older in the case where it's necessary to use it. So this really poses a kind of ethical dilemma. Kids have no rights of their own, and we know that there's limited safety data on Ozempic. There's no long-term risk assessed. Let's switch gears over to the psychiatric side. ADHD trends are going up. You notice how this kind of goes in parallel with obesity and hypertension, right? Anxiety and depression. Depression always follows anxiety, same thing. But the whopper of them all is autism. You could say that autism is a hyper-response kind of condition paradigm. Hyper-response, right? That's kind of a ongoing concept that we're kind of thinking about lately. 400% increase in the last 20 years. What the heck does that? 1 in 36 kids will be born with autism. So the ketogenic diet emerges as a really nice treatment that's been effective in small studies. Anecdotal reports are very numerous, but we have to do much more regarding robust research studies to bring it into the mainstream and to really knock off medication management, which does not really work that well. You're trying to chase different targets with meandering bullets, and it doesn't work very well. So we have some dignitaries here who have had really great success with going into keto carnivore and things like that. I just throw this in there because there's one case that really sticks out. That is a woman from Canada who was 2 years old when she acquired juvenile arthritis, went on Enbrel, an immunosuppressive agent, was the first kid to do so in Canada at 20 years old, after having 2 hip surgeries at 17, at 20, went on to do the carnivore diet and everything reversed, which is a really pressure test of her courage and also of what the carnivore diet can do. So these are all types of patients that I see in my practice. These are the kinds of different interventions that we do holistically. But the common denominator in all this is nutrition. Without nutrition, we really don't have a good holistic treatment plan. And what we do in our practice is we really look at everything. We look at social, developmental history, psychiatric, genetic history, and all those things, and we embed the questions in such a way that we're extracting information about holistic components like nutrition, exercise, sleep, and how does that translate into physical health to allow mental wellness to happen. You can't have one without the other. So these are some of the low-tech techniques that we use. Diaries, supplements, spreadsheets, sleep diaries, and things like that. And we put them into, we use them to measure holistic psychiatric progress, but we have to be willing to really conceptualize that as always like a pathway that leads into the most effective way that you can get to mental health, because again, like I said, you can't have one without the other. So I just wanted to give you two different cases that are on opposite ends to illustrate the kind of challenges that we have and the kind of wins that we have. One case, Cassie, 10 years old, battling with mood swings, anxiety, and some health challenges, as you can see by those labs over there. This is kind of reminiscent of what I used to have. The parents have a daunting family history with mental health issues. The mom is having knee surgery coming up, and the father just had his second hip surgery. Anyway, I get a text from Los Angeles from Universal Studios showing Cassie eating ice cream, which felt like a hollow victory to me. And, a few days later, they tell me that they're seeking out a second opinion. I just bring that up because I think we should remember that families are dealing with a lot of noise and misinformation, which adds to their reluctance, and we really have to fight back. The other case, Aubrey, a non-binary identifying sophomore in high school, changes her life by going into the crew team at their high school. So the twist is that even though I've diagnosed her with bipolar disorder, she doesn't have a genetic psychiatric history in her family for it. She knows of her IVF conception, and so that diagnosis is kind of, not very solid. But we had to go with something because her symptoms were fitting in. Remember what the professor, Dr. Johnson, had said before? That there's a lot of effects from the foods that we eat on how we present, so mood swings and things like that. But the twist in all this is that she was doing really well with rowing, but she was hindered by what she was eating. She listened to her coach, and she did a 1 gram of protein per pound of body weight, kind of protein intrusion to knock away all the carbohydrates. And she really started doing well. Mood, anxiety improved. And the second twist in all this is that she came up to me courageously and asked me if I could take her off of her mood stabilizing agent Abilify, which it was me that had to comply with her because she did everything she was supposed to, and she hasn't needed medications again. I guess that was it. Thank you all for having me. It was a pleasure. Let's all work on the system to really fight back on these issues and forces that are against us, really.